Let's start off with the news. I saw this morning that Dustin Diamond passed away at the age of 44 at such a young age of lung cancer. Specifically, he passed away from small cell cancer. Now, this is very unusual because by the time he got diagnosed at the age of, a couple months ago, he actually was diagnosed with stage 4 when it comes to lung cancer. That's a very unusual time and age to be diagnosed with lung cancer, especially small cell lung cancer. So lung cancer is a very common cancer that we're seeing more and more. And there are a lot of risk factors for this. The biggest risk factor by far is smoking. Smoking by far is the biggest risk factor that you can have for lung cancer. Now, there's two types of cancers for the lung. Basically, there's small cell lung cancer and non-small cell lung cancer. And lung cancer from smoking typically will present as small cell lung cancer. Now, we don't know for sure. I don't know in particular if Dustin Diamond actually had smoking as a history, though most people who get diagnosed with lung cancer get diagnosed quite a bit older, not at the age of 44. And usually also not at the time when you have stage 4 disease, meaning the cancer has spread everywhere. So how do we know if you have cancer, or how do we screen for lung cancer? So we actually have screening guidelines to know if you should get a CAT scan, a low-dose CAT scan or a CT scan to screen for cancer of the lungs. Now, if you've had a significant pack year history of smoking, 30 years or more, and you're over the age of 55, that may qualify you to get a screening test in which you can do a CAT scan, look at your lungs to make sure you don't have any precancerous lesions, and if they do, you can hopefully find those early and take care of them. Now, most people, if you're worried about cancer of your lungs, there are a couple things that you have to be aware about. For some people, it can present as chronic cough. And so if you're coughing all the time and we don't have a clear idea why you had a cough, it may be worthwhile for us to get imaging of your chest to see if there's something else going on. If you cough up blood, if you actually, whenever you start coughing, you actually cough up blood, that is a sign that something else is going on inside your lungs, whether it's an infection, whether it's collapsed pockets of air sacs inside your lungs, or that could be a sign of something else going on as well. If you have significant weight loss and we don't know exactly why you're losing that weight, that could be a sign of something else going on as well. And we typically diagnose this either with a CAT scan or a chest x-ray, but a CAT scan usually is the best test for us to do this. And by the time we typically find lung cancer, by that time it's usually already spread, and so for most individuals they have to undergo chemotherapy, maybe other treatment modalities. So it was very sad news I heard this morning about Dustin Diamond passing away, and I want you guys to be aware of some of the warning signs and whether you may be at risk for developing cancer of your lungs.